I fight so hard to keep that. And that's what I try to impart on my patients. Like, you have no idea how good you can feel.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Oh, I've been doing pretty well. I was just thinking about skin and integrative, and I don't know, these words come to me like SKINtegrative. What are your thoughts?
Oh my gosh, yes. All the time we think about this stuff. And today we wanted to take another approach where, we always talk about integrative medicine coming into dermatology and skincare in general and how we integrate different disciplines and different roles in the practice. And we talk about Chinese medicine as one approach and Ayurvedic medicine, and we had naturopathic doctors. But right there in our clinic, day in, day out, our PAs are right with us, nurse practitioners as well. And we wanted to give a voice and a place for these practitioners to see if they can come under the umbrella. Come join us with integrative dermatology right there and then. PAs, NPs, dermatologists, and beyond. Let's do this right here, right now. Shall we, Raja?
I think that's a great idea. And we're pretty lucky today because we have an experienced physician assistant, Brittany Scurto, and she is in Chicago. And she's practicing at the Dermatology Associates of Lombard. She did her training in Chicago as well. But what's really cool is she's also leading the SKINtegrative series for the Diversity in Dermatology group. And she also did a lecture with the Society of Dermatology PAs. So Brittany, welcome to the podcast. We're excited to talk to you.
Thank you so much for having me. I'm excited to be here.
And maybe we can kick things off by just telling us what got you interested in dermatology, and then you definitely did not learn integrative medicine in PA school. I will put money on that. But how did you get interested in integrative dermatology?
Absolutely. So I actually, when I started out as a PA, I started in different practices. I started in pediatrics. I spent some time in women's health. I was in urgent care where we definitely didn't do anything integrative for about 8 years. And now I've been in dermatology for 9, and I kind of fell into it, but it's been my passion. I didn't know how much I could love something. And throughout my life and throughout my work career, I really was taught the really standard Western traditional medicine. And I clung to that science as being kind of the end all be all. I didn't know any different. But interestingly enough, I also have struggled with multiple illnesses throughout my life. Since I was young, I was really struggling with my health and took many years to really get diagnoses down. But years later, found out I had multiple autoimmune diseases. In early 2023, I became a cancer survivor. And that is really what led me to start looking down different paths, more as a patient than a provider. I was blessed. My dad, who's not in medicine but finds it really fascinating, would always bring me kind of these integrative approaches to try and better my health. And I never really took him seriously because that's not what I learned in PA school. And that's not what I learned from my supervising doctors. But as I started to say, like, what I'm doing is not working, I need to look for something better so I can be healthier, so I can take care of my patients better, take care of my kids better, take care of my family better. I came across more and more integrative approaches, and that has really driven my health and well-being and my ability to do what I do every day. And so I've now been the person that a lot of these complicated patients come to, and I could recognize things because of my own experience. And now I can say, hey, we're going to try this traditional approach, but I want to bring in some other things here and see how you can respond and how you can do with this, and see if we can kind of get to the root cause of things and just get you better as a whole instead of just always putting out the fire.
Well, Brittany, I love you just taking us through the background and the history, because that really is how a lot of us come into this space, is likely through something personal. And I appreciate you sharing a bit about that. And, we'll touch upon that a little bit more. I did want to learn more about how you have shifted as a person now that you've gone integrative. But before we get there, let's talk a little bit about the SKINtegrative series that you're working on. Obviously, you've now started incorporating integrative dermatology. You've been doing this for a while, but now you're taking it to the next level, which excites us, which is that you're talking about it and you're talking about how one can do it. Can you tell us about your passion for education and what are you doing with this series?
Absolutely. I've always loved to teach, but I really felt like I had to get to a place in my career where I was worthy of teaching people, where I really had that experience and knowledge under my belt. And I think after 19 years and multiple specialties, I finally kind of got there. And very blessed to have some really close friends here in Chicago who were also in that realm. And they were starting this diversity in dermatology organization. They were having their conferences. And they actually came to me and said, "Hey, we think you'd be really good at this." And meanwhile, I was attending the Integrative Derm Symposium and, listening to Learn Skin
Love
podcast
it.
and doing, right? And doing the Learn
Oh, and
Skin
what was that
classes.
awesome podcast you're listening to? The Learn Skin
Right?
podcast?
And I will say, I'm going to throw this out there for you guys. If any providers have not gone to IDS, they need to go. This is one of my most favorite conferences every year. I don't ever want to miss it. And I've been very happy to get all the information that I've gotten from you guys. Diversity in Dermatology then brought me on to kind of help push this information even further within their venue. And so I did multiple lectures. I did one on, actually, I did two on nutrition. Nutrition is a lot of topics that you have to break down. I did one on avoiding toxins. I did one on, for healthcare providers, how to invest in ourselves and invest in our own health so we can be better for others. We spoke about cannabis and hemp. We have also spoken, the talk I did through the STPA was on autoimmune disease and integrative medicine. And then, of course, avoiding toxins in our everyday products and things that we're coming in contact with. So a lot of great talks. And then that led to the culmination of a speaking engagement at their conference, which is also my most favorite conference besides IDS, in March, where I talked about how to integrate integrative medicine in a 15-minute visit in a traditional practice. And I think that was probably the most important part of all of this, is that if you work in an integrative clinic, that's one thing, but most of us don't. But our patients are interested and they're asking about it and they want this, and we need to start bringing it to them. And sometimes we only have a 10 or 15-minute visit. So how am I fitting it in and getting to know my patient and bringing this information to them is really what the culmination of that was. And there will be other lectures. I have some more coming up on gluten and EMFs and things like that. But I think this was really the important one, to really tell everyday PAs, NPs, and doctors, like, you can be in a traditional practice and still bring this in and help your patients more than you were before.
So perhaps let's jump into it, Brittany, and tell us, what is your approach when you sit in front of a patient and you feel like, maybe I should bring up some integrative principle? Do you find there's some topics that are more easy conversation starter, if you will, to get patients to listen to you?
Yeah, I think that there's a lot of diseases that we see in derm that this conversation can easily be put in place. I think the obvious ones are your bigger disease states that we see a lot of: acne, eczema, psoriasis, hidradenitis suppurativa, a lot of these like inflammatory diseases or autoimmune diseases. Those are the big ones we see every day. They're our bread and butter. And these are big ones to bring in. HS is another one. Big ones to bring in the integrative approach. But I also do it with little things. I may say, "Hey, we're going to freeze your wart, and I can give you an option of a topical prescription product that you can put on it in between treatments. Or if you want to take a more natural approach, we can use that." So I kind of always start by just listening to the patient. You want to sit down, make eye contact with them, and truly listen to them and ask them questions that are going to help lead you to kind of get to know them and get a feel of why they're there, what they need from you, and how you can better help them. And then I talk with them about, this is the disease state that I'm seeing. This is education about that disease state. Because if we're not explaining it to our patient and explaining to them why they have this, what's going on, it doesn't have to be on a really detailed scientific level. You could break it down for them, but just educating them and giving them that time and effort and energy so that they felt heard and they feel like they matter. And then I usually will talk about, okay, this is what we're going to do to kind of put out the fire, so to say. This is what the more traditional approach we're going to take to try and get you better faster. However, I personally like to practice more integrative medicine, or I like to treat the whole patient. These are some keywords that I say. And I'll say our goal will not only be to just treat your condition, but take these small steps to overall increase your health and well-being so you have better quality of life, and hopefully we don't have to keep you on a large number of medicines for a long period of time. And then I kind of gauge them, because some people are not really interested in that, and that's okay. You have to meet these patients where they're at. But some of these patients are so grateful to hear this, and they're like, yeah, I would really, really like to do that, or I'm really interested in that. And then we can start talking about small things that they can do that can lead to bigger changes. And I'll explain to them, these visits are not super long visits, but you and I are going to see each other regularly. We're going to get to know each other. We're going to slowly take these steps to improve your overall health and get you to a better quality of life. And they respond very, very well. I feel like a good majority of my patients in my area are really looking for this integrative approach, and it's like a breath of fresh air for them when I bring it up. So I think it's always worth doing.
Yeah, it's not only a breath of fresh air I feel for my patient, it's a gasp of just thank you so much for allowing me the space to think beyond just the next medication. You bring up a lot of interesting points, obviously. One thing I want to highlight to our listeners is that the idea of how to do this in a 15-minute visit is not to suggest that you only have that one chance. And like you said, every patient may be ready at a different time. And sometimes patients come to us and really, we need to get the fire under control, so to speak. They have really bad psoriasis all over their body. Maybe we'll talk about diet in 3 visits, but inevitably, the time will come where for most of our patients, that the disease is under control, that we've done everything we wanted to do. I think especially in diseases like psoriasis and acne and eczema, where we have really good medical treatments now comes the follow-up visit that, the patient is clear, almost clear. And out of that 15 minutes, we probably use 5 to 7 minutes. There's kind of a routine to it almost. And then we're left with a few minutes to talk about something else. And I feel like in my mind, we're reducing the amount of time we talk about just skin, and we increase the amount that we talk about the whole patient. And so it's not just 15 minutes right here, right now, do it or be gone. It's the entire relationship you have with the patient and slowly infusing these concepts of health.
Absolutely. And the patient really has to trust you. You have to form a relationship with that patient. You can't just walk in and be like, oh, you have this, I'm going to give you this drug and see ya. They need to feel heard. They need to get to know you. You need to get to know them, because without trust, really, truly, you're not going to be successful in any form of medicine. Without trust, you're not even going to be successful in traditional forms of medicine. So in my experience, when I can earn that trust from them, I just get so much more benefit out of it, and the patient does so much better. And ultimately, that's what we all want as healthcare providers. We didn't get into this to not be successful. We want our patients to do better.
Absolutely. And then, to transition from your patients doing better, I know you talked about how you were drawn into integrative medicine because of your own personal desires for growth as well. And I think that that's the same for me. How have you changed, and what do you do differently with your diet or your lifestyle now that you've learned about things?
Oh my goodness, the change has been so drastic. Even I think about my daughter's turning 16 and my son is 10. So they're about 5.5, 6 years apart. And I even think back of how I fed her and what products I used on her versus him. And then I think about now, 10 years later, how drastic it is. And this is a slow process. every day we learn more and we grow and maybe we make these little changes. But I would say big things for me is that I work really, really hard to eat as much organic, non-GMO, natural, healthy, from the earth food as possible, because I'm a firm believer that nutrition is at the core of a good majority of these diseases and a good majority of the inflammation and cancers and things that we have now. So I usually will open it up to my patients with nutrition first, because I feel like that has been a game changer for me. And I also feel like if you can get that process started with them, that slowly, their taste buds start to change. They crave less sugar, they're feeling better, and then they become even more open to it. I have been very strict about what we're putting on and around our bodies, the products that we use on our skin every day, and then even products in our home. We've gotten to the point where we make our own cleaning solutions. I would say that we use an all-purpose spray made of like 1/3 white vinegar, 1/3 alcohol, isopropyl alcohol, and 2 parts water, 1 part, 1 part, 2 parts. And that all-purpose spray we use for everything, and it's cheap, it's easy to make, it's low toxic. I can even use it as hand sanitizer, and you don't get eczema flares because you have the vinegar in it. It's been a game changer. So we're not using all these toxins in the home. I don't allow any fragrances. I don't allow any artificial dyes. I don't allow any artificial colors. And then for self-care, I mean, this could go on forever and ever, the things that I've done. But for self-care, I make sure to do meditation, deep breathing, get therapeutic type massages. We go hiking in nature. We've done forest bathing, Pilates, all those things that I need to do to keep my body healthy and going. Because I notice that when I don't make these drastic changes, or I give in and kind of go backwards a little, I feel terrible, and I'm not myself, and I can't do what I want to do in this life. So it's really interesting when you're somebody who was so sick for so long that you were just in survival mode, you slowly start to get better. And when you get healthy again and you have like a little setback where you're feeling not well, you can't imagine how you lived like that in the first place. You can't imagine all the years that you lived in such excruciating pain because you didn't know what good felt like. So now that I feel good, I fight so hard to keep that. And that's what I try to impart on my patients. Like, you have no idea how good you can feel if you just take this journey with me, and you'll never want to go back.
Those were actually very strong, powerful words. And I love this. And one of the principles that I think is crucial to remember for us clinicians when we talk about integrative medicine is, as opposed to pharmaceuticals, by and large, we will not prescribe to ourselves. These interventions, if you will, we can totally try on ourselves. And it gives us so much more power to talk to our patients when we've tried this ourselves, because we can all say, oh, this biological worked great. It's so easy. You just inject it and poof, and it doesn't hurt, or you barely see the needle, and all this stuff that we say, but we've never really injected this into our body. But we can all do meditation. There's zero harm virtually in it, etc. So I think the ability to prescribe these treatments to yourself, try them, and then come to your patient with firsthand experience is so much more empowering. So thank you for sharing that and allowing us to make this observation. We went through the whole circle with you from joining kind of the group, the family of integrative practitioners, empowering your patients, and then seeing how that affects you. What do you suggest your colleagues who have not had that revelation, if you will, and are still not aware of the integrative intervention, that are just sitting there waiting for them to empower their patients? Any advice you can give your colleagues?
Yeah, of course. So I think first, it's really important to just put yourself in a position to learn and be open to something that's different than what you learned in medical school or PA school or nursing school. Because I think being open is the first step. And then absolutely trying things on yourself. Try those deep breathing exercises, try changing your diet and see how your body responds. try to maybe do a different type of meditation or change up a product that you're using, maybe just cutting out fragrances. In dermatology, that's a nice one for us. Cut out dyes and fragrances. Just try it on yourself first and see if that makes any change. And once you do something yourself, you not only can potentially see the benefits, but you can explain it better to your patient. You could say, this is how I go about it. And your patient, that helps build that trust. They take that as something really coveted because you're actually doing it versus just telling them to do it. You are walking the walk that you are asking them to walk. And you're going to kind of pull together that there are certain means for this, or there's certain access or motivation. And so you're going to be able to feel that out with your patients. You're going to say, wow, that's a really great thing that I love to do, but maybe it's a little too price heavy, right? So maybe I encourage this instead. And you'll recognize that when you're doing it yourself. So definitely trying things on yourself, definitely growing and learning and being open, and then putting yourself in places where you can learn. Put yourself at an IDS conference, watch Learn Skin videos, listen to the Learn Skin podcast, go to my SKINtegrative series, read books. There's so many amazing providers out there that have so much amazing information, and it's just a matter of finding it. And it's there. It's available to you at your fingertips. You just have to kind of want to do it.
Brittany, that was amazing. And I just want to say thank you for talking about the Integrative Derm Symposium. I mean, all of your experiences is the exact reason that we started that conference. And for all of you listening, the Integrative Derm Symposium is September 26th through the 29th, but most of it's going to be the 29th is the last day, is like a combined program with estheticians and dermatologists. We make that really interactive, and it'll cover topics that'll swing in all directions. But nevertheless, it's going to be in Arlington, Texas. We have an amazing resort down there. And Brittany, you can probably attest to this. We have a really fun time together. And so
it's awesome.
It'll be really
I'm
good.
so excited.
Now, on the flip side, you talked about, the SKINtegrative series. Now, you have a special code for our listeners, don't you? So that they can register and get signed up. Can you talk about that?
Yeah, I'm super excited to offer this. So it just became available. We first gave the SKINtegrative series. We were doing it on Zoom meets where people could attend. And then we gave it to our participants at our conference in March. But now we're opening it up to the public. And so it's diversityindermatology.com. You're going to go to the website, click on SKINtegrative series, and then you guys will have the Learn Skin 50 code. So just type in Learn Skin 50 and that'll get you $50 off of the Learn Skin series. And we are going to be adding more lectures to it, which I'm excited about. And as I learn and grow, I will keep spreading the news and teaching. I think the big thing for me after becoming a cancer survivor was that I do not want anybody to live with chronic disease or cancer ever again. And I will do whatever I can in this lifetime to keep that from happening and to better our medical world, our overall health, our patients' health. I just really want to create a better space in the time that I am on this planet.
Brittany, it's been truly inspiring to have this conversation with you. And we want to thank you again for joining us.
Thank you for having me. It's been an honor.
We hope you enjoyed today's episode. It doesn't have to end here.
Not at all. In fact, at Learn Skin, we're continuing to develop new programs to help you stay up to date on the latest in the field. In fact, our newest program that recently launched is known as the Dermatology Clinical and Integrative Essentials, also known as the DCIE program.
That's right, Raja. Why don't you tell us more about the DCIE?
This program is designed for PAs and NPs who are starting fresh in the field of dermatology, or even if you have years of experience under your belt.
Well, that sounds pretty useful. So what does the DCIE cover?
Well, we've teamed up with dermatologists, PAs, NPs, and primary care colleagues to develop a comprehensive curriculum that covers the most common concerns seen in the dermatology clinic. But then we've also layered on what we do best at Learn Skin, which is integrative dermatology. So you're treating the patient from the inside out and the outside in from an evidence-based approach.
Holy moly, this sounds like a wealth of knowledge. So do you recommend new or seasoned clinicians to join?
Well, both. If you're new to practice, this is an excellent starting point from the nuts and bolts of dermatology. And for our veteran colleagues, you'll get up to speed on the latest emerging conventional therapeutics. And for both of you, you'll learn about the integrative approach, including topics such as nutrition, diet, botanicals and herbs, mind-body approaches, and more.
Wow, that's a lot. Can this be done online?
Yes, it can, because we're rolling with the times, Hadar. This can be done online and self-paced. But we also have directors who guide you along the way and host live virtual case discussions, guest speakers, and peer-to-peer mentorship sessions.
All right, my friend, this sounds like a very cool program. So for you listeners out there, if you want to enroll in the DCIE program soon, go to learnskin.com. And until then, stay curious.